We should think about deprescribing really as a way of optimizing the medications that people use. Our healthcare system is really designed to kind of add more and more. And what happens over time is that people tend to accrue medications that they might have needed at one point, but they no longer need. Or maybe medication was prescribed that never actually helped them in the first place, but there wasn't the wherewithal, the coordination to actually have stopped that medication. So these medications accrue and accrue. And by deprescribing and by focusing on looking at which medications may no longer be needed, which don't provide a net benefit to the patient, we can really think about that as a way of improving their health and optimizing their medication use. And so some of the strategies to help overcome those barriers include dedicated visits that are focused on medication review, as well as taking it out of the hands just of clinicians, but engaging other members of the healthcare team, engaging pharmacists, engaging nurses, engaging other healthcare professionals, engaging the patients themselves to review their medications and to really ask the right questions about, do I need to still be taking this medication? Is it helping that patient, or is it helping me if I'm the patient? Or is it possibly causing me side effects? And so because there's a fear of making symptoms worse or making diseases worse, we're often hesitant to stop medications, even though there's a good chance in many cases they're actually not providing the patient any benefit. So getting over that uncertainty is a big barrier. And so some of the most effective interventions to address deprescribing go beyond just the technical aspects of which drug to deprescribe or what's the most safe way to stop it. Do you stop it abruptly or do you taper it down over time? But rather, some of the most effective interventions really address the idea of fear and uncertainty.